So no one wants to talk to their parents about it, let alone their grandparents. We're talking about sex, but you might want to have the talk once you've heard about the graying of HIV.
It's a number of people over 50 now living with and potentially spreading that virus. 10 to your side, Stephanie Harris looks at the impact and risk in Hampton Roads. Stephanie?
Well, the good news here is people with HIV are living longer. The bad news, about 1 in every 6 people diagnosed last year in Virginia was age 50 or older. It's creating new challenges for doctors and the dating scene for seniors. Bob Bailey is a self-proclaimed house husband who tends daily to his partner, their pets, and his pills.
My morning regime is that, but only this pertains to HIV. The rest pertains to old age.
Bailey, who's 57, has been living with HIV for more than 12 years.
I grew up in the Rock Hudson, Freddie Mercury days, and you know, to me, my immediate thought was, I'm going to die.
But many patients are now living into their 80s and 90s. Medicine has come a long way. Mindsets, not as much.
You know, there's still that stigma from back at the early days.
It's evident in this article recently published by Eastern Virginia Medical School, in which a widow named Amanda describes how she waited a respectful amount of time after her husband of 34 years passed away before she began to date. She wasn't promiscuous, slept with just one man, and got HIV.
Probably women who have reached menopause figure, hey, I'm not going to get pregnant. Not realizing that if they have a sexual encounter with someone that's positive, they can become positive.
The truth experts say is HIV is just as easy to get at 71 as it is at 17. Nearly 100 people over the age of 50 were diagnosed in Virginia last year. Men, women, gay, straight. Health experts say it's time to have the talk about safer sex.
Step outside the box and, you know, have those conversations with parents, because there's a lot of elderly single parents.
Dr. Tanya Kearney also advises doctors talk to older patients about getting tested, and parents talk to children starting in middle school.
At least starting those conversations about sex and risky behaviors and abstinence and self-esteem.
Because while you can live with HIV now, it's expensive. That 1 pill a day Bailey takes to manage the virus can cost up to $25,000 a month. And older patients must also consider interactions with medicines they take to treat other age-related conditions.
I'm fearful that that the millennials and the younger generations are getting so comfortable with that they're letting their guard down somewhat. You still have to keep your guard up.
Bailey takes lots of precautions, and after 7 years together, his partner is still HIV negative. They plan to live a long life together. The Trump administration has launched a campaign to end HIV transmission by the year 2030, targeting areas where the most new infections happen and getting highly effective drugs to people at risk. You can find out more about education and testing information with this story. I posted it for you on wavy.com. Stephanie Harris, 10 on your side.